Hello, welcome to Maternity Nursing 2. Today I'm presenting material prepared by Miss Joyce Catherine. The title is Menstrual Disorders and Infertility in Women. The learning objective for today is that we will know and understand what are the menstrual disorders and infertility in women, and we can also find out and make nursing diagnosis or nursing care in the cases with menstrual disorder and infertility in women. The first one is amenorrhea. So amenorrhea is the absence of the sensations of menstruation. It is actually as a disorder symptoms, and the physiological conditions happen in girls, such as in pre-puberty, pregnant women, nursing mother, and even in menopausal women. So it's actually where there is no menstruation that happen in women. And it's divided into two, the primary and the secondary. So primary amenorrhea is actually when there was no menarche or a menstruation, and no secondary characteristic that appeared at the age of 14. And it's also when the menstruations is not appearing or not occurred through the age of 16, even though there are sex characteristic that has been shown in the woman. Secondary menarche or secondary amenorrhea is that when the menarche or menstruation did not come for more than 6 months or more than 3 menstrual cycles. And here, whereas previously menstrual cycle came regularly. So the woman in amenorrhea, what happened is the woman used to have a regular cycle, and then after 3 times of menstrual cycle, there are nothing there's no menstruation, so that's what we call amenorrhea. Etiology of amenorrhea can happen because of pregnancy, of course, because there is baby, then the ovum is not coming out, so there is no menstruation. And also there's a history of disorder that happened in hypothalamus, pituitary, and ovarian axis, as well as there is also anatomical abnormalities within the woman body, as well as there is disorders in endocrine system, and there's also a history of chronic disease. There is actually the side effect of certain treatment, and also there is bad at eating disorder, as well as the mother do heavy exercise and having emotional stress, or even because of the side effect of using oral contraceptives. For the assessment, we have to take the first step to ensure that the patient is not pregnant. The second one is we then assess thoroughly for the history of health, and when does it happen, what happened before that, as well as we check with physical assessment or examination throughout the body of the woman. And then we need to be specific, assessing the components of woman age. For example, if this is an adolescent or young adult, or even in the stage of perimenopausal. So we ask according to age, and then we understand that, well, there should be the history of menstruation before, but if it has never happened in the life of probably a very young woman, then we need to understand something is wrong. Well, the management of amenorrhea is actually related to the work of hypothalamus. So nurses will help to find what is the stressor, how to deal with the stressor, and also have to check the history of taking medication. So probably because of taking certain medication, then there is no menstruation, then we need to reduce or even stopping the consumption of the medication, so then we can start the menstruation. Something also funny is that sometimes women, they try to lose weight, and this also cause a psychological stress, and then what happened is there's no menstruation, so it's amenorrhea. And also, if the woman has the history of using substance, so we have to check whether it's the usage of the substance that then become the trigger point or the reason why there is no menstruation. Another thing is that we need to do what we call deep breathing exercise and relaxation technique so that we can help repair what is wrong or things that cause amenorrhea to happen to the woman. Another one about athlete. Specifically, if a woman is an also she is also an athlete, so we have to reduce the exercise duration, increase her body weight, as well as educate on bony density and osteoporosis, because there is a chance of having trouble in another part of the body. And then, if the woman undergo estrogen therapy or hormone therapy, probably it could signal that you don't need to produce egg, and then that's why we have what we call amenorrhea. Now, the nursing diagnosis related to anorexia is actually anxiety related to the changes in health status, a disturbed body image related to biophysics and developmental stage, perceptual and disease, situational low self-esteem related to the function disorders. For example, the function disorders is primarily amenorrhea, so then the child needs to boost up the low esteem because probably he is then with a situational low self-esteem. Another one that is not that is very important as well is lack of knowledge related to lack of information obtained about the disease. So we have to make sure that the patient that take part in this will be able to understand thoroughly about what is going on within her body. Another one is what we call dysmenorrhea. So dysmenorrhea. Now we are coming to the dysmenorrhea. So dysmenorrhea is the pain during or just before menstruation. So the pain is actually located at the suprapubic area or kind of like lower abdomen. And the pain is like being squeezed or persistent dull pain that radiates to the lower back or the upper thigh. There are two types of dysmenorrhea. The first one, primary dysmenorrhea, which is the condition related to the ovulatory cycle and excessive prostaglandin release. And then the secondary dysmenorrhea is that when the menstrual pain that occurs later in life and is associated with pelvic abnormalities and is pathological. So for the first one, what happened is that the cycle itself is a problem. So it's not marking like very precise and on time type of cycle, and there are also a lot of prostaglandin released to the student or the woman. And actually, the second dysmenorrhea, as we mentioned before, is that is the menstrual pain that occur in life with abnormalities that is going on the woman's body. About primary dysmenorrhea, so this is excessive release of prostaglandin, which increases amplitude and frequency of the urine contraction and actually cause urine arterial vasospasm, where will then cause ischemia, and that's why we have lower abdominal cramps. So primary dysmenorrhea appears 6 to 12 months after menarche, and most women will be in their late teens or then just early 20s. The sign of symptom of primary dysmenorrhea is actually low back pain, weakness, sweating, gastrointestinal symptoms such as anorexia, nausea, vomiting, diarrhea, and even central nervous systems such as drowsiness, syncope, headache, and poor concentration. The management that we can do is actually to provide information and support, to provide warm compresses and pads that is soaking in warm water with help to vasodilate and relaxing the muscle, which then will reduce the ischemia in the uterus, and there will be also the reduce of cramps. Massage of the lower back relieves pain and relaxes the vertebral muscle, and it increases the blood supply to the pelvis. Euflorage on the abdomen provide distraction and alternative focal point, as well as yoga, acupuncture, biofeedback, meditation, and exercise will then lead increases of vasodilation. And also the good nutrition, where we reduce the salt and sugar intake to reduce the fluid retention, and with the drugs and contraceptive pills, which can also reduce the amount of prostaglandin as well as herbs. Well, the secondary dysmenorrhea is that it's associated with the pelvic abnormalities such as adenomyosis, endometriosis, pelvic inflammatory disease, endometrial polyps, myoma, and uterine fibroid, which actually these are all the care and service that they provide. And it's when we put like intrauterine devices, then it will also cause a secondary dysmenorrhea. Well, the pain is dull. It's radiating from the lower abdomen towards the waist or thighs, and then the woman um, will experiencing the feeling of swelling and fullness in her pelvic. And this is most common happen for the woman age 23 and above. And the treatment is actually aimed to eliminate the underlying diseases in dysmenorrhea. Now, what are the nursing diagnoses? Obviously, as you can see, the patient might be feeling pain, so you can take pain associated with increased uterine contractility, hypersensitivity, and uterine nerve pain, as well as ineffective individual coping related to emotional overload. And then there will be also impaired nutrition, less than body requirement related to nausea and vomiting. So this is actually what you can do to your patient when she presented herself with um, dysmenorrhea. The next one is endometriosis. So endometriosis is the presence and growth of endometrial tissue that happens outside the uterus. And the main symptom is dysmenorrhea, infertility, dyspareunia, chronic pelvic disease, heaviness in the pelvic, and pain radiating to the legs, um, and diarrhea and painful defecation. So the pain will then radiate to the thighs of the um, patient. The management will be treatment based on severity. So if the pain is mild and still wanting to uh, get pregnant, then we can use NSAIDs to lower or to ease the pain. And then when the woman have experiencing severe pain and delayed pregnancy, they can use oral contraceptive so that we can help to control the endometrium growth as well as to prevent abnormal growth. And if the drug is stopped, then the signs and symptoms of endometriosis may reappear. And then we also assess the GnRH agonist therapy, and then we do surgery as well as we do counseling and education. Like as you can see here, this is what we call endometriosis. So it can happen outside the uterus and it's not a life-threatening condition, but it can cause what we call infertility. And this is how it is. You can see there is this one over here, so that's what caused the endometriosis. Another thing that we need to consider as nurses is what we call nursing diagnosis. So we make sure that there is pain that related to menstrual disorder, there is risk of self-interference related to infertility, there is ineffective family coping related to physiological and emotional effects, and there might be also high risk of body image and disturbance related to menstrual disorder. Now we move on to what we call infertility. So in infertility is actually the inability to get pregnant after 12 months or even without using contraception. And it's primarily where the couple fails to get pregnant and to continue their offspring. Infertility can be caused by female and male, and both has the equal factors. So infertility, again, it's divided into two, primary and secondary. So the primary, it happens within a certain time, which means 12 months. So despite regular intercourse, there are no pregnancy that happen between 12 months. Then secondary, have the pregnant have been pregnant before, they are not pregnant again, even though you have had regular intercourse within 12 months. So what happened in the brain? So this is what we call hypothalamus. So hypothalamus produce the gene H at our age, and then this will stimulate the pituitary gland by producing FSH and LH. So then the FSH stimulates the ovary through molecular maturation, which then stimulates the estrogen, then stimulates the secretion of LH hormone, and then the ovulation occurs. And the ovum come out, and then they will um, get to the remaining follicle to degenerate into corpus luteum, and corpus luteum will produce the hormone progesterone, which will prepare the body for pregnancy. So the etiology is that there is pituitary disorder, so the body can't produce FSH and LH, and there are hypogonadism, so it's actually the pituitary failure, as well as there is what we call hypergonadism, so where's the secretion increase for FSH and it also increase for LH. So then these follicles will do not grow normally, so there will be the ovulation disorder type 3. And pituitary gland actually will produce hormones, prolactin, hyperprolactin, which is caused FSH and LH as they can't produce. And this will both cause the fertility problems. So there also can happen because there is tumor inside the pituitary, and then hypothalamus produce inhibiting factor for P and can inhibit prolactin production. For etiology, there is the increase of prolactin that caused by hypothyroidism. There is ovarian disorder, PCOS or ovulation disorder, hyperandrogenic or excess androgen hormones in the blood that will affect menstruation. There is like 4 years old cessation of menstruation, genetic disorder, autoimmune disorder, radiation or chemotherapy, pelvic disorder, ectopic pregnancy, sexually transmitted disease, the use of contraceptive, endometriosis, which leaves the scar tissue, as well as the abnormal cervical mucus during menstruation. So the estrogen is abnormal, so that the mucus will inhibit the penetrations of sperm. Risk factor actually age, smoking, obesity, family history, congenital abnormalities, and infertility problems can have a big impact. Apart from causing medical problems, infertility can also cause economic and psychological problems. Broadly speaking, infertility couples will undergo a long process of evaluation and treatment, and this process can be a physical and psychological burden for infertile couples. And conditions that cause infertility from wife factors 65% and from husband factors 20%, and other unknown condition is for 15%. One study showed that the cause of infertility related to problems from the wife's birth tubal, menstrual problems, uterus, ovary, and even sexual disorders. The test tube baby, or IVF, fertilization can be interpreted as fertilization, while in vitro is outside. So in vitro fertilization is a process of fertilizing an egg by sperm outside the woman's body. Well, the nursing diagnosis that you can see, there are anxiety, disorder of self-concept, low self-esteem related to fertility disorders, as well as there are grief and anticipation that associated with a poor prognosis. All right, so that's all the references that we use for this. Happy studying!